Hi, it's Julia. I'm in my home studio and I have a couple of things laid out, a foam roller and our OPTP pinky ball. This is available pretty much anywhere. A tennis ball would work just as well. It doesn't have the same kind of give that a rubber pinky ball would have, but nevertheless, this is more about a conversation, and I'll be demonstrating shortly why releasing certain muscles, listening to the tightness in your body, the restrictions in our joints in our body, and how that informs our strengthening program and how we can just get more range of motion, more out of our workout. There's a lot of emphasis on maximum intensity in our fitness culture these days. And listen, I'm all about strengthening. Most of what I do is about how to allow the body to get the most it can out of your workout so that you go into life, you age gracefully, you age in a way that feels as comfortable as possible, because there's always things that come up, of course. Fascia is the connective tissue that runs throughout our whole body. It's important that it stays hydrated. It's also important on my end to explain that all our muscles have an insertion point and an origin point. So if something feels tight, it may be strong and tight. It also may be a little weak and tight. So we have to work it, but we also have to understand why it's tight, where it's coming from, where there's restriction, how to use movement that we do in Pilates and in strength training to assist with mobility, like a stretch, or in Pilates we do a lot of lengthening, we do a lot of holding, isolating muscles while we're stretching them, which is great. And then there's this other part of it, the releasing part, that I have found in my time working with all different types of bodies, shapes and sizes, conditions, ages, where we need a little bit more TLC. We need a little bit more sensitivity, listening, and application of this kind of release work in order to get the most out of our joints, our bodies, our muscles, and take care of ourselves in the process. They go hand in hand. Facts. Real talk, let's get into this pinky ball release in the QL, the quadratus lumborum muscle of our lower back. So this muscle that I talk about pretty much every day connects from the 12th rib all the way into our posterior pelvic wall, the top of the iliac crest. So this muscle sort of fans out, and it also connects to the transverse processes of our lumbar spine. So if you've got compression in the lower back and you're trying to get some relief in the lower back, how do we do that? In addition to strengthening perhaps our core, strengthening the glute muscles that connect to the hips, how do we get a little bit of release so that the muscle becomes more elastic? Two ways: you can stretch and then you can myofascially release. So if we begin on the back, and I always like to start with the glute. So I'm starting at the top of the pelvic iliac crest where the glute medius connects to the top layer of your pelvis. I'm just gonna hover the hips, press with my right hip into that ball, and wag the hips side to side, shifting your pelvis right and left, massaging and kind of kneading out that fascia until it becomes softer, more supple, and it doesn't pinch nearly as much as it does from the beginning. If this feels easy for some reason and it doesn't feel like anything, along the way, as you go out toward the outer layer of your hip, closer to where the leg starts to connect into the hip joint, that tends to be a place where you'll feel a little bit more pinch. I'm just gonna lean into that spot, take a breath in, breath out until that muscle softens and opens up. A nice visual for this is imagine the ball sinking into your flesh, and then your fascia, your connective tissue, surrounds the ball. There's that connection between the mind and the body that allows you to just breathe and give in temporarily to the discomfort of that muscle releasing. For me, definitely that's happening. And then I take the ball out and I just notice what feels different between my hips. Generally speaking, that right side of the lower back actually feels more grounded. It feels like I have more weight on this side of the floor than I do on the left side of the floor, because those muscles have now softened. The next layer would be to explore where that muscle connects into the 12th rib. You'll know that you're not on the bone when you can kind of sink into it. You're just to the right of your spine, finding that floating 12th rib, and I'm just gonna drop my right hip because it's on my right side and sink a little bit more into that really tight muscle. A couple breaths, because breathing expands and contracts this fascia. I'm adding a rocking motion to add a little bit more pressure on that ball. When you find a spot that feels particularly tight, you breathe into that area. And then when you're ready, release. Another way to kind of see if there's anything that's changed since releasing is you can stretch your legs. For me, right away, from even just that, I can now feel that my right leg is longer than my left. And so some of these subtle techniques allow us to go into the next series of exercises a little bit more open, less bound, less stressed in our fascia, in our bodies. Our hips have a different range of motion. The ribs have a different range of motion. Already I can feel that I have more rotation in this direction than I do in that direction, if you can tell. Some things to think about and incorporate into your week, into your month. Pay attention to how you feel, and I'll see you next time. Thanks.